Mr. Smith. My name is Andrew. I'm going to be your nurse today. Can you please repeat your name and your date of birth?
My name is Robert Smith. I was born on July 26, 1985.
Okay, and then what is your allergies if you have any?
Peanut allergy.
Okay, and then what hand do you write with the most?
My left hand.
Okay, we're going to be doing the IV on your right arm. I'll be right back and I'm going to get the materials.
Alright.
First, perform hand hygiene and apply gloves prior to contact with the patient. Next, gather your supplies and set up materials on the bedside table. Prior to inserting the IV catheter into your patient, make sure to explain to them why they need it. In this case, Robert Smith needs an IV catheter for blood testing and receiving medications. After explaining the procedure to your patient, you may then apply the tourniquet above the intended IV site. After the tourniquet is tied, palpate for a suitable vein. Avoid areas with redness, tenderness, rash, pain, or infection. Extremity affected by previous CVA, paralysis, dialysis shunt, or mastectomy. Release the tourniquet temporarily while you prepare your items for inserting the IV catheter. Open the saline lock, the IV extension, and the IV kit. When opening the IV extension, ensure that both tube endings maintain sterile. Securely attach the luer lock end of the IV extension set to the sterile flush. Do not touch the point of entry of connection. Prime the extension tubing with the saline flush. Prepare your items for inserting the IV catheter. Cleanse the insertion area, allowing it to dry completely, and refrain from touching the cleansed site. Reapply the tourniquet properly. Next, perform venipuncture. Anchor the vein below the site and instruct the patient to relax their hand. Warn the patient of a sharp stick and insert the needle appropriately. Observe for blood return through the flashback chamber. Lower and advance the catheter appropriately, loosening the stylet over the needle catheter. Hold the skin taut while stabilizing the needle and advancing the catheter off the needle. Thread the catheter into the vein properly. Next, connect the primed extension to the IV catheter. Before the next step, you must remove the tourniquet. Then, flush the vein with saline from the attached pre-filled syringe. Once the veins are flushed, remove the syringe. Secure the catheter and then apply the appropriate sterile dressing over the site properly. Tape the IV extension beside the tegaderm. Label the dressing with the date, time, and RN initials. When done, discard of your supplies and dispose of sharps in the appropriate container. Remember to remove your gloves, perform proper hand hygiene, and thank your patient for being cooperative.